Okay, very good afternoon, everybody who is now joining us here. And as usual, every Friday, tea and tales. So I have some very interesting people for you for some good conversation this time. If you look at it, we had Doctors' Day, and if you see the crisis that is going on in the country and the kind of difficulties that we face not in the country but in the world across, doctors have emerged as the savior, and they are risking their lives, their entire knowledge base in trying to protect each one of us, and they are really going as much as they can, which is there. I think all our childhood we heard about army people, the way they risk their life to save us, to give us peace, and to ensure that we have a comfortable life. I think doctors coming to this role at this level, though when as a child also even today, I always believe doctors are the face of God, and they have no always played a big role. So this time I thought to bring in some conversation on their life, their thinking, how they look at scenarios, what is their mental frame when they're out there battling it for us, how they look at things. So for you today, we have in the conversation first and foremost Dr. Kanwaldeep. She is in radiology. She's an MBBS and MD. She's a medical director of IV Health Group. She was awarded the prestigious President's Medal by the President of India, no? And she is an honorary FRCS from Royal College of Surgeons, London. Oh my God, ma'am! When I read about all that you have done, long respect, ma'am. No, unbelievable, amazing. Then we have Dr. Atul Ingale from nephrology. He is MD Medicine, FRCP Nephro, FSAS MS Nephro, FCCP, Director Nephrology, Fortis, IHH Group of Hospital Mumbai, Honorary Professor of Medicine, University of Mumbai. He conducted the first dialysis and the first kidney transplant of Navi Mumbai. He is won Health Icon Award by UP government, Indian Gold Achiever, Abdul Kalam Excellence Award by Government of India, Vikas Ratna Shiromani Award 2005, Health Icon 2017 Award. Unbelievable, sir. Like what all any one individual can achieve is something which always amazes me. And then we obviously have Dr. Anil D'Cruz from Oncology. He's an MS, NDB, FRCH. He's Director Oncology, Apollo Hospitals, President-elect, and President of Union International for Cancer Control. First Indian to hold this position. No, and he was instrumental in initiating super specialty training course in head neck oncology in India. I have never met such a galaxy of stars of doctor together, and for the right reason, not because I want some treatment. I think that is something which really is very heartening to me. Otherwise, going to hospital at times, I do get scared. Even though my daughter, my sister-in-law, they're all doctors, doing their own. But it's so interesting to have you all on board, sir. And we have some good conversation to begin with, sir. I'd request Dr. Kanwaldeep to talk about her experiences of being a doctor, of serving the society, and how and what comes to your mind when you see a crisis like COVID, and what is the first thought that you have, from a perspective of being a doctor, and what are the challenges you face, ma'am? So just any thought that comes to your mind. Very, very lovely to hear that.
So I'll give you a little brief description about myself that I'm a radiologist by training. And after working in PGI for a couple of years during my residency, I got into practice. But seeing less corporatization of healthcare in this part of the country, in Punjab, we thought of starting our first super specialty hospital in Punjab. That was in 12 years back in Mohali. And then we built hospitals in other tier 3 cities of Punjab. So my experience of COVID, pre-COVID and post-COVID timings are that at least in this part of the country, how we are seeing things are that definitely there is a big fear psychosis in the minds of people. So they are not coming to the hospitals with the fear of contracting the infection. And the change which we have seen is that the people who are coming for the routine elective procedures, they are not coming anymore. And we are only catering to emergencies and people suspecting to have suffering from COVID. So this is the change which we have seen in all the hospitals. Another change which I have noticed that in tier 3 cities, like if we talk about Punjab, we have hospitals in Nawashahar, Hoshiarpur, Khanna, these tier 3 cities of Punjab. We have seen more emergencies. We have seen more patients coming to these hospitals because of lack of travel to bigger cities. So that shift which I have seen, that more work is happening in the tier 3 cities because of travel restrictions, and less work is happening in bigger cities. This is one change. Another change is that we there are it's hard to get health care providers in this time because of the fear in the mind of workers. Like we used to have nurses and other paramedics from Haryana, from Himachal, from J&K. So most of these people during the lockdown phase, they kind of out of fear, they moved back to their respective states. And these healthcare workers are not ready to come back and work. Rather, they're waiting and watching. So the healthcare providers are getting thinner and thinner. So resources are getting very thinned out. Definitely, the cost of healthcare has gone up because we want to protect our staff totally. So it's a very hard time. It's very hard time for healthcare providers, and all those people who are working in the hospitals, of course they are again at the front run and are scared of contracting the disease. But we are trying to create a balance, and although we are not seeing many cases in Punjab, so far so good, and we are definitely geared up. We have made certain infrastructure changes in all our hospitals to have separate wards and ICUs for the COVID patients. So, yes, it came as a surprise, shock, whatever you call it. But we are geared up and we are ready and we are confident that we'll be able to manage the crisis.
Ma'am, so nice of you to say so. In fact, in one of my earlier interviews, I had mentioned about that in our country, the tier two, tier three infrastructure of health has to move up. No, and that time when Mr. Modi was launching Ayushman Bharat, and we are supporting it very strongly. I mentioned the kind of money which will flow in because Ayushman Bharat will ensure in 10 years' time the average life expectancy of Indians will move over 5 years. So they asked me, how do you make the statement? I said, the health infrastructure will improve in tier two, tier three towns. The life expectancy of Indians will definitely move up. Now, that is one bet which I have moved, and I'm keeping data and statistics ready. I think I should be able to prove
Right.
what I made the statement in, I think, Economic Times then on this basis.
No,
So,
I echo with that. I agree with you, whatever you said. Yeah. So definitely,
uh,
tier three cities are seeing more work at this point of time.
Dr. Atul Ingale, I see you have your gloves on. So, sir, Malab,
Yeah,
I'm in Pune right now. Pune is the hotbed, and I get scared, no, at times. But then I'm in essential services. I have to serve my customers, and the office is on. I come to office, and in between fear and in between duty and in between how to innovate for the customers is something in which my mood swings, sir, no, at times, no. And then how do I pull this off, sir? Do you also have such emotion like the one that we have, sir, or as doctors, you're super god and you feel we will know just be there? What are the feelings that you get, sir, as an individual level and then no, as a community, sir?
good evening, friends. And first of all, let me thank Mr. Tapan. You really flattered me by those kind words. Coming to emotions, as this session is of tea and tales, I hope you will allow me to use little bit of the shell language.
Please, sir, all yours.
So, when this pandemic started, see, there was a discussion all over the globe, started with China, then Europe, and then US. We were that way not very much bothered, anticipating this virus would get killed by the heat. This is the usual phenomena because it is a basically characteristic of virus which would kill when it get exposed to the outside temperature. So we were anticipating India is very hot, so we may not face the music. And slowly this COVID entered, and mainly I would feel it's a foreign travel or foreign travelers which brought this virus to India. 21st, I still remember the day. My wife, she is a director of internal medicine and she is heading the task force against the COVID. She got exposed to one of the patients from JNPT. JNPT is a port at Bombay, Jawaharlal Nehru Port. This patient presented with a history of fever. And to our utter surprise, this patient turned out to be positive. Now it was a panic situation. Everyone pressed panic button because she did not take proper care. So she underwent testing and a quarantine in the beginning. I followed the same because I'm her husband and staying together at the home. So we both were quarantined and tested. By grace of God, fortunately, we both were negative. But the step one, what we learn is precaution and the prevention. As Mumbai is a hot state, it leads India, even in aspects are related to the COVID. N number of patients were emerging from that day onwards. And we were anticipating shortage of manpower, shortage of beds. We learned one thing, the prevention would be the key. If you teach or make people understand awareness, so many of the things has to be changed. For example, like in India, okay, we greet with the folded hands. But nowadays, if you see, we shake hands or we hug each other. And if we don't shake hands or we don't hug each other, the person may feel offended. So you have to make understand that you have to increase the distance between two person. It's you have to adopt the original Indian style with the folded hands and stay away. Same time, you have to wear the mask, clean your hands. Of course, many things changed later on as more studies came out. But this was more of an emotional part, how to behave self and for others. For doctors, it was pretty easy for us because we are in touch and we're aware of this. But how to make other people understand? Initial period of lockdown, everybody took it. Lockdown is meant just government is scared. But no, that was the right decision because India, the main human nature is to we stay in a group, and that would inflate the disease. That was what was anticipated, and that is how lockdown came into the picture. So changing over from a normal behavior to something very different, which you are not tuned to, was the most difficult task. As far as personal things are concerned, there were many changes because professionals, everyone would agree, are mainly dependent on the maid. The basic need of the house. So you have to keep maid away. So start doing your own work. In personal experiences, what I experienced is basically it was very difficult to maintain my regular three-piece dress, tie, blazer, and coat. Because who will wash it? Who will press it? Etc. Then I found out the shortcut for that. I started wearing this hospital scrub, which is activated at the end of the day, and I don't have to press it. And looks were not mattered because whenever you are entering the ward of the hospital, you are covered with the kit. This is about the doctors, but as far as people who are from the non-medical profession, it was very difficult for them to understand this change. People were not maintaining the distance, which was must. So they started learning when they paid a price. If you can say one relative, one family member almost got involved or infected with this COVID in Mumbai, and they started learning experience. So much so that today you won't be surprised there is a total lockdown again for Mumbai, Navi Mumbai, and the surrounding area because we are not able to control the inflated numbers of COVID. People has to understand and they have to take their precautions. You cannot stop the business. You have to because you have to run for your tummy. Yet what precautions you will take? If your employees doesn't understand, make them understand. Make them some facilities available, or rather force them to follow some ritual or steps to be taken, so that you can control the disease. Because there is no 100% of Ramban Upay for COVID, and COVID patients are not dying because of COVID infection. They are dying because of the complication in the form of what we call it as a cytokine storm, and it affects top to bottom each and every system. I'm a nephrologist who deals with the kidney failure patient. Kidney failure patient means for layman जिसका जो बंदे का साइलेंसर गया, जैसा गाड़ी का साइलेंसर बंद हुआ तो गाड़ी बंद होती है, ऐसा ह्यूमन बीइंग का किडनी फेल हो गया तो इट्स समथिंग लाइक दैट. It was very difficult for me to adjust, take care of dialysis patient also. At the same time, it was literally peer pressure, you can say, no manpower. So I have to get inducted myself into the task force for managing COVID patient. That is the reason What you are seeing me with the wearing gloves and all that, I'm coming straight from the hospital to my clinic. Now I cannot keep that shut also, and I cannot modify that. So I have to take care of myself, I have to take care of the patients, and I have to see that there is no transmission. I think these few changes which I could recollect.
So huge respect, I think, for
Thank you
people
so
like
much.
you, And based on story, let me give you some examples. I was in Germany, and like you said, shaking hands and this thing, which was before that, and people were doing namaste there. No, I think
Right.
getting to a culture is very critical. I do not know how many of us would have been in villages, but as a child, because we had some ancestral property in village, I would go to village. There were two, three rules then. No, I'm talking about around 953. I'm talking, let's about 45, 44 years back. Even then, the rules were simple. If I was entering the house, I had to ensure that my feet was clean, my hand was clean. People going out were wearing gamsha. Ladies would put in a small veil when they would go out. No, and all food was warm, freshly prepared, cooked. Now, if I look at it, somewhere we lost this. We started eating cold food. We started shaking hands. We started hugging. We go back home, and before food, we'll take a bath. It was mandatory, in spite of what it was. Only then food would be served. Now, if I look at it as a culture, billion of people of this country were following rules, regulations, which would ensure that they were safe from any kind of virus even before COVID. Yeah? We have lost that. Today, when COVID is on, doctors are shouting from the rooftop, please just do three things: maintain distancing, wear a mask, clean your hands, have properly cooked food. And we're not listening. It is surprising. Billion people were listening and doing things across cities, villages much earlier before. And today we call ourselves that as a nation, we moved ahead, we become more educated, we have become more richer, and we have lost the simple civic sense of listening to the government and doctors for betterment of all. We may be try to be born, but because of us, if four people die, who will bear the how should I say, on the moral responsibility because of our stupidity? Some people died. Can't we be a bit cautious? What is the hurry? Can't we just take simple precautions, which over generations as a country we have done? I think very powerful point raised by Dr. Ingle. I move to Dr. Anil. Well, Anil, you have seen a lot. I think different sections, part of Apollo Hospital, cancer. If I look at COVID, people say with comorbidity, there's a huge risk, and you're there fighting out in the field. What are your reactions, Dr. Aril? How do you see this situation, and what are the learnings that you would like us to learn from your experience?
So, two, three very quick points. I'm not going to repeat what has been said. I totally agree what Kanwaldeep and Atul have said. Also, all your observation, plus the various observations I'm seeing on chat that are coming from some very interesting delegates who are really writing some great points. I'm going to say one thing. While I agree with social distancing, everything, there are two forms of transmission of the COVID. One is droplet and the other is formite. To put it simply, droplet is when you sneeze, you cough, you talk, and formite is when you touch surfaces. To me, the most important is droplet. Of course, wash your hands, don't shake hands with people, fine, but stay away from people who might infect you with a droplet. So, if you have anybody who has any symptoms, not feeling well, very good social distancing from these people. Have barriers, which are your masks that you use. Don't stay in closed spaces with a lot of people for a long time. You don't know. You may not shake hands, but if there are eight people sitting in a coffee room at the hospital, if one is a carrier and he's talking forcefully, you're sitting with him for more than 45 minutes, he or she might transmit it to you. So I want everybody to be aware that droplets are important. Open spaces, keep distance from people, keep away from people, and don't stay with anybody because you don't know who's a carrier for a very long period of time. That's my first message to you. The second message is a general comment about healthcare in our country. We all talk about tertiary healthcare, we talk about great hospitals, corporate hospitals coming in tier 2 cities, tier 3 cities, and that's great. But remember, for the health and well being of people, we don't need vertical growth in healthcare. We don't need total horizontal growth, which is primary healthcare. We need to have a diagonal approach. If you are going to spend all your resources on hospitals and our primary healthcare is lacking, you will be able to treat cancer patients, but you'll get them in a last stage, which they'll eat your resources. If you put all your money on primary healthcare, it will take many years before we see the impact. So, my message is whoever is listening to us, you are a person who can influence policy makers, various other people. In your insurance sector, you could do an insurance where you cover my cardiac illness, but your insurance should be a wellness insurance. 80% covers my cardiac stents and bypass, but I'm only entitled to that because 20% of my coverage is on preventive cardiology. I go for regular screenings. My weight is monitored. I think even for cancer, people must be screened. Ladies must have their pap smear. Men must be screened for PSA. They should have a head and neck, which is the commonest. And these are very simple and easy tests. So I'm going to say that yes, we'll treat people, but let's prevent and let's have a diagonal approach. That's very, very important what I want to tell you.
Very powerful point, Dr. Anil. I think thank you very much. I'm actually very touched by this statement of yours for two reasons. One, this diagonal approach that you mentioned, you have a strong advocate in me now. I promise you, every forum I will take this. I never saw it from that perspective. I was looking at how healthcare can be built across the country, what all should happen. Because my strong belief is a good healthcare system in a country will bring up life expectancy of Indians, and that is why life expectancy of Japanese compared to life expectancy of people in Uganda, there's a huge difference of 40 years. It's just healthcare, no? But the way you said
Correct.
it, like preventive healthcare, primary healthcare is very critical. You'll be happy to note, Doctor, I think the insurance industry has started right at a very nascent stage on the preventive part. I think we have come out of the product with a fitness band in which, if you are fit, you get better incentives and you get better healthcare. We also have a checkup every 4 year for our policyholders, which is up to a limit, which we give them to get checkups done. I think, but more has to be done on this because I strongly believe the idea is not that when people fall ill, what do you do? No, obviously we do the best then, but if you prevent more people, it's a brilliant thing. I think I'll tell you one small story because I think Dr. Ingale is from Mumbai. He'll understand. Pune Mumbai highway is one of the beautiful highways in the country. It's rated as one of the beautiful highways. You go in monsoon, it's very beautiful. At the same time, statistically, it's one of the most dangerous highways from road accidents and deaths. So, and I analyze because as an insurer, I get all these statistics that deaths are happening post midnight and before 4. So I made a rule in the company that, and all my drivers, the rule is that you have the authority to stop driving and take the car to the nearest hotel or motel if it's midnight, and not stop before 4, irrespective of who gives you an order. You have immunity from the CEO, and nobody can do that. So I was questioned that how many lives have you saved by doing this? I said, I do not know. But if one death had happened, then none of you would have forgiven yourself. No? So, like you said, if we work hard on the primary healthcare, we do not know how many lives we'll save. But we definitely know that as a country, we become healthier, happier, and we move to the next level which is there. So, very powerful point made, Dr. Anil. I'll come back to you again, Dr. Kanwaldeep. No? On the mental health issue, I think there's one thing which I really strongly feel now, and it's again just an observation. People are scared. Some are scared, some are flamboyant. It's two extremes. I don't see many people in the middle who are taking rational decisions right now. No, so either people are very, very scared, and they're not even venturing out for minimal things which they can do, taking out precautions, or others have become very flamboyant and thinking, okay, whatever will happen statistically, I'm young, nothing will happen to me. I think these two extremes happening. So I see mental health issues coming up. I see also a lot of stress on the health system, like though in Punjab less right now, but Dr. Ingale will know in Maharashtra is very, very severe. So what do you think on the mental health part? What is the message that you would like to give people on this part? Though I understand that you are not a mental health expert, but like just a doctor, you're talking about different people. So how would you look at it, and what are the points that you feel And this will be to all three of you, sir, and ma'am. I think I strongly feel this has become a big issue, and I'm not sure how will we address it, because as time progresses, this will actually become a bigger issue than the pandemic itself. Is my belief. Maybe wrong, but I somehow feel this is getting out of control also, which is not yet noticeable.
So, how I look at it is that one has to really utilize this time, whatever this lockdown time, or there are people who are working from home. They are in that environment, they are not able to socialize, which is the so called normal lifestyle we have. So, this is something new normal. So, what should be done in the new normal to keep your sanity in check? This is how I look at it. And I'm a very spiritual person myself. So I feel that whatever circumstances or the changes come around us, how adaptive are we to them? So we should be able to align. It's easier said than done. So how I look at in our country is that people are not taking mental illness as an illness. They are ignoring, and the friends and the people around us also tell, or kind of, no, it will be fine, take it easy. But I think if somebody is actually suffering from a mental ailment, that person needs to take it seriously, or his friends or relatives should actually take a doctor consultation and take the treatment rather than just trying to counsel. But I'm sure these things, listening to good music, connecting yourself with whatever spiritual power you believe in the higher energy, these things help if you're actually in tune to do that. So one should take out time to do that. I do that, and I think in this time I have got more time on hand. As I was sharing with Dr. Anil earlier, that to reduce the crowding in the office also, I have reduced my office hours. So few hours I'm cutting down and spending more time at home so that we have less crowding in the office also. So anybody who can actually work from home should work from home. So we have made those changes in our organization, and we are doing that. So keeping all these things, and I think somebody needs this treatment for a mental ailment, they should go for treatment. It should not be a stigma which is there in our society, that neither it is taken seriously or nor people go in for treatment and taking help of psychologist and going to a psychiatrist. One thing I
Huh?
want to add, I don't know if I'll get opportunity again to talk about it. You were talking about tier 3 cities and tier 2 cities. One point I want to make here is that in our government setups, the so-called civil hospitals or primary health centers, they have manpower, they have infrastructure to primary and early secondary healthcare also. If we develop a private public, private public kind of jointly, we do some program pp models, which so called pp models, if we work on those, we can utilize our resources and use infrastructure of the government to give better care in the government setups, which is not happening. This is something at the state level. People should get into that and make and give affordable healthcare to people who come to the government setups. I hope I'm making myself clear here. And anything else you want to ask?
No, ma'am, I think it's brilliant. In fact, today only we had a meeting with Niti Aayog, and the National Health team, and one of the discussion is that how do we extend the National Health scheme to people, above that level, and they can pay at the rates at which is being done. And this was being discussed. But the private-public partnership is something
Yeah.
which is very, very important, ma'am. And I fully support what you said. And I hope that people who are listening and know we can build this up, and that will transform the point that
It
Dr.
will.
Anil mentioning. That's a
It
very
will.
strong point.
Yeah.
And taking it from your point, I think my next tea entails I'll get some spiritual leaders on. No, I think that's a good point. And you'll see it, ma'am, next week, next Friday, I'll get somebody. Let's hope that helps people to listen to. And third point is mental illness is not about being mad. No, let us take the stigma away. I think if you look at statistics, every 1 in 4 people would be going through this phase. It's just about taking some help, like you would do for any kind of illness, be it diabetes or be it any kind of
Right.
hypertension. Just like that, just walk in and take help, and be happy about it. Don't try to drag on and reach a stage where suicide starts happening at a young age, which is more disturbing and depressing than anything else it can be. Dr. Ingle, over to you. I think a lot of comments on your previous comments coming in, from people who are listening on what you said.
Okay. Regarding mental health, you want me to speak?
Yeah, I think that's the one point I really want each one of you to know, whatever you feel like. But I feel the very important thing, the next big thing coming after COVID as a pandemic, I strongly believe somehow. No, I mean,
Basically, is a very important point in any human's life. Mental health or mental illness. Unfortunately, the society has given a stigma to it. So nobody is ready to discuss it out in open or with their family physician. When you come to this COVID pandemic, the main thing what is happening to a person is depression. All of you will agree with me from medical side. Now, this depression is a multifactorial. First of all, it starts with how about me and my family? Whether it would be affected, what would be the outcome? Second most important point is what about my job, my tummy, whether I can feed my family. The third thing is what about my career? What will happen to my career? Whether I am losing a precious time in this, whether I am being stagnated or stopped somewhere. And lastly, whether I am really fit mentally and physically to face this situation. I myself also put in that frame what is happening. The God has given the best gift to human being, that is adaptation. We keep on adapting to the situation, and that is how humankind is the best thing happened on the earth that I could say. So there are various ways to get adapted. Some people would look at the spirituality. Okay, fine, you get peace out of that, no problem, go ahead with that. Some people would listen to music, fine. Some people would go to their hobbies and the passion, no problem about that. Some people would look for something else. But what I'm trying to advise over here is look into the self. First, try to find out the solution. What I do in my lifestyle, I first ask myself what worst can happen and then take step so that you are mentally prepared. Yes, if this happens, the plan B, plan C, whatever it is. Coming to the health wise, this is the right time because most of you are home, work from home. Now, work from home, definitely there is a difference in the environment. You are very restless. Honestly, अरे जिसकी शादी हुई है more than 10 years, वो वाइफ को कंटिन्यूस देखने लगेगा तो पागल हो जाएगा और वाइफ हस्बैंड को देखेगी तो I'm sorry about that, but that is
you're
a
actually saying second part, otherwise we would be in serious trouble right now.
so
It's not
you
that
have to.
bad.
I understand, but usually this what I have seen when everything is too much, anything is too much, it becomes undigestible. So you have to adjust with the situation first of all and try to cope up or comply. Like many people started cooking. I won't be surprised what that program comes on the TV, Australian chef. So there will be huge line of few meals from India. So adjust, diverting yourself to the cooking, taking care of house, that will divert your mind for some time. And you will have some pleasure that you are helping your better half and making her at ease. Secondly, you should concentrate on the health. Now, you should not be overzealous. Oh, I have to maintain health. I will start turning outside. Oh, that's too dangerous. You start doing some exercise, some yogas at home to keep yourself fit. And I strongly believe physical exercise definitely gives fitness not only to the physical health but to the mental health also. Thirdly, I strongly believe in meditation. See, meditation is not that spiritual, but meditation is where you can focus and try to control your mind. Calming mind, I would. So once you get some control your mind, automatically everything comes. Okay, it's a solving jigsaw puzzle. Lastly, coming to the earning and the job, well, you have to adapt. And answer to this, who will be better person than you to give for that? How to adapt and adjust? For us, there is no change in lifetime, but market and CEO. It's very different picture. That is the reason whenever I used to go to airport, I always used to get fascinated by people who rush to the counters or various places with the attache in hand and very well dressed in three piece. And that is what we call a corporate group. But these are the people, means you are the person who knows better than us how to adjust for financial circumstances or the problems. As far as health, mental health, physical health, I think I was clear enough. If anybody has got any more questions on this, they can. After coming to extension of Dr. Anil sir's point about the taking care of self, there was some question in the live comments. See, it's very simple. Sir has clearly elaborated fomitus means droplets coming out of mouth. You have to maintain the distance. Believe me, even if you speak loudly, you are transmitting the virus. If you laugh out loud, it goes away almost millions of virus. That has been proved in the various scientific studies. So the best way is put mask, stay away from some person at least 2 meters distance. That is the best precaution. Secondly, not to touch anywhere unnecessarily. नहीं ना अपने इंडियंस को बहुत आदत है इधर भी बार दिखा या कुछ रॉड दिखा उसके ऊपर टिल्ट होके खड़े हो जाते हैं. They're touching whole body over there. So you have to be very cautious about that. Thirdly, as you have correctly pointed out, our culture, when you come back home, previous days, what I've been born and brought up abroad, but whatever my grandparents told me, when you enter the house, you take away your shoes, slippers, wash your feet and hands, change the clothes, and then sit in the drawing room or dining, whatever it is. Same holds true for this COVID prevention. You have to remove your shoes or slippers or chappals, whatever it is, outside. Come naked, fit inside, straight away go to bathroom, change your clothes, put your clothes in a washing machine or a hot water, just dip it in that. Or if you put it in sodium hypochlorite solution, that is also not very wrong. Take a hot shower bath and then touch your kids. You will the best taking precautions of yourself. If you are outside, if you are touching something, you better have sanitizer. Excess of use of sanitizer is also not good because that can cause skin cancer. I think Dr. Anil would guide through some light on that. But optimal use of sanitizer and proper use of sanitizer. These are a few points one should take care of.
Thank you, Doctor. I think no, I loved your statement. And look at the worst case scenario. I always do that, Doctor. Let me not say. Let us say. I always say, okay, now let me look at the worst case scenario. I lose my job. What happens? I start from there, no? And how does it go? And the interesting insight on the corporate world, rushing to airports. 20 days in a month, I did that, Doctor. Every month, so many years of my life. And I meet hundreds and thousands of people, no, all over. Imagine a person like me in a lockdown environment. No, I don't meet people. I don't travel. What a change it has been. And it has been rightly said, it is not the fittest and the fastest to survive. It is the one who can adopt who survive. No, if you want
Absolutely.
to survive, big.
That's well said.
That is how it goes, sir. Over to you, Dr. Anil. I think some comments from your side. I think this conversation go on forever. We're already ahead of time. I think already over 38 minutes now. We normally try to keep
Yeah.
it for half an hour. No, but I think it's an interesting conversation going on. Yes, Dr. Anil, your
I,
views.
I I don't know if it's an advantage or a disadvantage to be asked to speak third after two powerful speakers because they've covered most of the points and you moderate so well. You fill in the gaps, so there are no points left for me to make. But having said that, I think your point on mental illness is very, very important. Again, I'm going to make general points. I agree with my two other panelists. I'm not going to repeat what they said. So, mental illness, I'm going to just make one point vis a vis COVID, and then I'm going to make a point vis a vis mental illness in general, which is also important. So, with COVID, COVID is here to stay. It will be with us. It's not going to get over next Monday morning. It can be with us for 6 months. It can be with us for 1 year. It can be with us for 2 years. So, first thing, keep your mental sanity. You cannot do all these very specific attributes for the next 2 years in the kind of society that we live. So don't have mental illness. I get a deja vu 25 years back, 30 years back when HIV came in. We as doctors were very scared. We would not operate a patient. We would say the patient is in the window period. I'll get HIV and I'll die. But today we live with HIV. We do a triple H test, we all operate, we keep ourselves safe, and we know what we have to do. And exactly same is going to happen with COVID as well. It may take the cost of healthcare a little up, but it will protect us from other infections. So my message to everybody who's listening, for any ailment, for anything new, fight it with knowledge, not with ignorance. Don't take your knowledge from WhatsApp. Don't take your knowledge. Please read, go to proper sources, get the right information. And a panel like this is an ideal case where experts give you knowledge. So don't get paranoid about corona with lack of knowledge. So that way you'll keep your mental sanity. The second point, mental illness in general, as I made a point of having total strengthening of healthcare systems, I make a point that we should have holistic health. Your health should include physical, should include mental, should include spiritual. You'll see all emphasis on physical, diet, gyms. No one is bothered about mental health. WHO estimates 15% of population have some sort of mental illness. Mental illness is not like you see in the films, which are lunatics running around talking nonsense. You can have mild depression, which is mental health. How do you know you have it? When you don't function optimally. Keep a watch if you are a boss on your colleagues. They may be great workers, but you might find them having mood shifts. They may perpetually depressed. They don't socialize with people in the lunch break. Of course, keep your social distancing now, but you can make out that they just do their 9 to 5. They're always looking gloomy. Apni tankha leke they run. So these are subtle signs that you may be having. And how do you do it? My esteemed panelists have already told you things like be aware of your environment, yoga, spiritual. But I always believe talk in any problem in life, whether it's father, mother, whether it is father to children, whether it is to your spouse, whether it is to your colleague, lack of communication is the biggest problem. Share your problems with someone that you can trust. And I'm sure that do your yoga, do your music, all are they, but get someone who you can trust. And I think you, as the CEO of such a big company, should also have that kind of engagement among staff. You have yardsticks to see that they perform in their deliverables, but there should also be a support system to help them if someone is facing a problem, that they have that support system that they can walk into your office or your health officer's office and be able to share a problem which will help us to diagnose this at early and probably improve their performance as well. So I think it's towards holistic health that we need to drive.
Unbelievable. I think no, I got doctors on the panel, but you all can be corporate coaches. I'll tell you why, Doctor Anil. The beauty is when I speak to my team and when I talk to them that you want to be a good leader, focus on physical, mental, and spiritual health. I think that is something which we talk about. And in fact, when COVID started, I told my head HR that my people should have access to psychologists and counselors free of charge and no data to us. And the only data we took is how many, at what percent of people approach them. You'll be surprised to know, doctor, that the 33% of people approach them. No, the point you said, when people get access and you remove the stigma, people are happy to talk. And the conversation part is something I strongly believe in. And that's why we started this Tea and Tales. I believe conversations, talking to people, figuring it out, talking about the issues, listening to people, understanding, being in the shoes, it's so very critical. We are losing it in the social media time. Just some fancy post on Instagram about the food that we're eating or no, or the beautiful vacation we have been on to. That is not what life is about. Life is about sitting with friends over a cup of tea, discussing the most critical issues and having a good laugh over it. I really enjoyed talking to all of you, Doctor, and so thankful to each one of you. I don't think I could have asked for a better panel. Such a lot of information, such a lot of simple, straight speak, such a lot of powerful ideas. And time just flew by. It's already 45 minutes. People, did you notice? a half an hour show goes to 45 minutes, and if I allow it to continue, go on for hours, and we still be so excited and glued to it. Thank you very, very much, all of you. Indebted to you for all your guidance and time that you given. Thank you very much.
Thank you
Thank
so
you.
much.
Thank you. Thank you.